Hello students, welcome to KN Education YouTube channel. In this video, we will discuss about the hypertension and which is very important for your SEM exam, and we are going to take the questions from the direct from question bank of the RGUHS itself. Okay, so what will be the question? We will see, that is hypertension, right? So hypertension, from the hypertension they have asked the 10-mark question, that is what the definition of the hypertension. Second one is modifiable and non-modifiable risk factors they have asked. Lastly, they have asked for the pharmacological management of the hypertension, right? So we'll discuss one by one. Actually, you people know about the BP, right? So the BP means what? The blood pressure. Actually, when there is a fluid status like plasma and the blood components, these both exert some pressure on the blood vessel wall, right? So that one will call it as what? Blood pressure. So how much blood pressure it is giving? The normal blood pressure will call it as normotensive, right? So the normotensive value, you and all we know that is about 120 by 80 mm of Hg, right? So whenever it comes the condition like hypertension, this will be called as silent killer. The BP will be more than the normal. The normotension is about the 120 by 80 mm of Hg, but actually it will be not that much. Okay, that means 140 above, that is systolic blood pressure, and 90 mm of Hg above, that is diastolic blood pressure will be there. So if it is the BP more than 140 by 90 mm of Hg for 3 readings up to the several weeks or the week, okay, so this one will be said as hypertension. So why this hypertension occurs? What are the factors that is including? Before going to the factors, we have to understand what is primary hypertension and secondary hypertension. See, primary hypertension, it's a very dead easy, that is due to the essential activities. Whenever you are doing some physical exertion, or whenever you want to run, or you have some stress, that time it will give some essential organs, vital organs. Okay, so the blood supply is needed to the vital organ. Like if the muscle is, if you are running, that time the muscle will be the vital for the blood supply. Are you getting? Vital for the blood supply, I am saying. Okay, that means here the this one, what you can call the stomach, intestine and the urinary bladder, during the physical exertion or running, that time there is no need of that much of blood supply to these organs. There is a more blood supply is needed to the muscle. That time what happens, here there is a fluid will be increased and blood components also increased for the supply of the blood to the muscles. That time what happens, actually there is an increase in systolic blood pressure. Automatically, if there is an increase in systolic blood pressure, means after that it has to go back to the venous return, or it will give some exertion due to some the activities which is done by the angiotensin and other things. Okay, so we will discuss that. Now what happens, the diastolic BP also increases and systolic BP also increases. Thereby the hypertension will be categorized into the primary hypertension and secondary hypertension. For the essential thing, if it is happening, primary hypertension, overall the 85% of the human beings or a normal healthier person, they may have the primary hypertension, and that may resides easily. Okay, so now this one, secondary hypertension, due to some cause, due to some disease condition only, this secondary hypertension. So several factors will come, several causes will come. Due to those causative factor, due to those disease conditions, this hypertension has been erupted or that has been produced. Okay, the secondary hypertension, it is atypical. Okay, and this one will be the common in 70% in less than 12 years of age. That means puberty, less than puberty age people, they may get 70%, and 10% of people in adult, they may get secondary hypertension. Okay, we'll move on to the what are the risk factors then. So there are two types. First one is modifiable and second one is non-modifiable. If anything you can modify it, like obesity or like if you make any restrictions, or if you are in limitations, okay, like alcohol limited or the cigarette smoking limited. So if you are taking the more than that means if you are taking one pack of cigarette daily means you have to leave that. That means taking one is enough, taking one cigarette is enough. Like that, if you modify your lifestyle, then there is a changes in your hypertension. Otherwise, if it remains as it is, thereby it will be causes what? Hypertension. Okay, so obesity, if you are not doing any exercises and you people are sitting more than 6 hours, see, one research says that more than 6 hours whoever sit, okay, so they may have the chances of 19% of to get die in next 21 years of age. This is one research I found. Okay, so you should not sit more than 6 hours. Okay, so that is the one thing. And another research says that 11 minutes if you walk per day, it will be extends your this much, the extends your life expectancy. Okay, life expectancy, what you have 25 years of age, so that will be increased correctly. Okay, that will be increased, increased, not extended. Okay, next, diet. Whatever the diet you are taking, like sodium hyper, if you are taking more sodium or more glucose or more caloric than your body requirement, that time also there is a causes of hypertension. So modifiable means you can modify, but you are not modifying, but the client is not modifying, so that's what we call it as that will causes the hypertension. These are all what the risk factors, not the exact causes. Risk factors means there is a possibility but not sure. Okay, that is risk factor. Okay, so next is non-modifiable risk factor. If anyone is obese means there is no need of pakka they have to get hypertension. There is a chances. Okay, if they are having the habit of cigarette smoking, there is no need of only getting this one hypertension. They may have other lung diseases also, right? So leave that. We will come to the non-modifiable risk factors. In that you can't modify it. Age you can't modify. If you are having the 25 years of age means you can't modify it to 20, or you can't modify it to 15 years of age, right? So that will be the same as it is. 25 years means 25 years. Next year it will be the 26. That's it. Whenever there is arrives of your birth date, right? And race. So many of them are having the different colors and different race. You may have the secondary hypertension. Okay, so the non-modifiable factors and modifiable factors, these things are there. Okay, so we'll move to the next question. Next that is topic, that is management, the hypertension management. How you will manage the hypertension? So if you didn't saw about the RAS system, please I request to you to see it once and come back to the management. Otherwise you will never understand what I am saying. Okay, so the management, in this we will combine this management of the hypertension into medical management and nursing management. Firstly, we will see the medical management one by one. A, B, C, D. A means AC inhibitors, B means beta adrenergic blockers, C means calcium channel blockers, D means diuretics. See, always remember that AC inhibitors, lastly most of the drugs will get prilled in the last. Okay, the beta adrenergic blockers LAL, and CCB is apens or apens, nifedipines, like that. Okay, diuretics, that may varies because there are many varieties of that. Okay, so this RAS system I have done there. Okay, you have to see and come. Okay, next, ACE inhibitors. ACE inhibitors, I will give this one in the I button. Okay, so see that I have been already said in that. Okay, ACE inhibitors. First one is the captopril, lisinopril, lamipil, and enalapril. So all the drug have a, that is pril, right? So the nursing management, why this one is needed that much? AC inhibitor, actually it will makes what? AG1 to AG2 conversion is there. That's why it will be called as angiotensin converting enzyme. If you are if the pulmonary capillaries want to convert the AG1, what it has came up there in the pulmonary capillaries, so that will releases there are already present there, that is ACE enzymes, that will convert the this angiotensin 1 to angiotensin 2. Now the angiotensin 2 these are ready to bind with the receptor, right? So in the normal way, okay. So but in the AC inhibitors, what it will make, it will inhibits the ACE, and it will makes up to not become AG1 to AG2, right? Okay, thereby there is no increase in the BP, as you all saw in the video of the RAS system, right? So there is no increase in the BP. Okay, so thereby if there is a if you are giving the drug to the hypertensive patient to become a normotensive, so if you are giving more, that may causes hypotension. That's why you have to check the BP, and you have to check the potassium level, whether it is increased or whether it is decreased. You have to see whenever you are giving these drugs, okay. And observe the side effects, whether is there any side effect of this AC inhibitor that may causes the dry cough as a side effect, okay. Next one, we will go to the next A, that is ARB, angiotensin receptor blockers. As I said in that video, so ARB, angiotensin receptor, whenever the angiotensin 2 binds with that receptor of the muscle, and that will makes what, that will makes the vasoconstriction, and thereby there is a presence of hypertension, right? So now if you block that receptor, then there is no attachment of the AR, that means AG2. So the angiotensin 2 will never attaches to this one. So thereby what are the drugs that will restricts the AG2 means, that is telmisartan and losartan, okay. So it will be helpful in the heart failure and also hypertension, okay. So combinedly if it is there means you can give it, what, that is angiotensin receptor blocker, okay. So what are the nursing management you have to do? Same as it is, the BP and the potassium level you have to check. So alpha 2 blockers and alpha agonist. See, alpha agonist, these are these will make still the vasoconstriction. You should not give the alpha agonist still it will make the vasoconstriction, right? So for that you have to give, for this hypertensive case you have to give the alpha 2 blockers. So you given, so that will makes what, vasodilation. Now the thing is, if it vasodilates, there are some side effects, right? So that's why you have to, that is nurses management, what they have to do, check the BP, and they have to check for any cyanide level you have to check, and cardiopulmonary monitor you have to do, okay. So these are this is about the ARB. Next, beta adrenergic blockers. In this lols I said, okay. So atenolol, metoprolol, timolol, labetalol. Always remember this metoprolol is the drug of choice for, this is the drug of choice for the angina pectoris, and this is the drug of choice for the hypertension that means in the pregnancy, okay. If there is a presence of pregnancy induced hypertension like eclampsia or pre-eclampsia, if it is there, for that type of patients, or gestational hypertension, whatever the hypertension in the pregnancy, if it is there, many types are there, whatever the types it is, so that time you have to give this labetalol, and that is the drug of choice for the pregnant who have the hypertension, okay. So you have to cautious about the checking the BP and heart rate, and cautious about the congestive cardiac failure, and respiration rate, very important, very important. Why? Because the respiration rate, that time here you are giving the metoprolol and atenolol. See, the beta adrenergic blockers, always remember, so here it will make the vasodilation, but it will constricts or it will spasms the bronchus. So bronchus muscles get spasms, so that's why. So mainly that is non-selective beta adrenergic blockers will do these type of actions. Thereby you have to be careful and conscious about the respiration rate, whether it is normal or abnormal. If it is going abnormal more than 20, abnormal more than 20, okay, if it is going that, so that time you have to report to the doctor, okay, or otherwise you have to notify, or you have to write it in a document if it is more than 20 or less than 25 if it is there. If it is repeated more than 25, it is that time you have to notify, okay. Next one, CCB, that is calcium channel blockers. The calcium channel blockers, actually the calcium is present if it is more calcium is present, that time the SN node will transmit some calcium ions into the myocardial cell, thereby the depolarization, there is no delay, and that will be very fast contractions are there due to the more contraction, more forceful contraction. Okay, so the calcium channel has been agonisted already. There is a easy travel for the calcium due to more calciums are present. So that if you are making more force of contraction, that means in the hypertension cases I am saying, in the hypertension case, if the patient is having more forceful contraction, in that case, for that more forceful contraction only there is a more cardiac output and hypertension. In that case you have to give the CCB, that is calcium channel blockers. Understood? So that will makes what? That will, whatever the receptor of the calcium is there, that will be blocked by this one. Okay, it will be limited the calcium intake, or it will stops the calcium not intake. Okay, so influx of the calcium into the myocardial cell. So it will be inhibited by whom? The calcium channel blockers, right? So what are they? That is amlodipine, verapamil and deltazim, and nifedipine also comes. Okay, so these drugs will decreases the force of contraction, okay, by blocking for depolarization delay in the myocardium. Okay, so it will delays the depolarization. It will not makes a complete absence of depolarization. If you make complete absence of depolarization, there is no contraction, there is no relaxation. That means it's a very sad thing, that never happens here. Okay, so there is a delay in the depolarization of the myocardium. Understood now? Okay, thereby if there is delay, and thereby there is a decrease in the cardiac output, and thereby there is a decrease in the BP. This is the treatment, right? Next, nursing management. In that, if you give, whenever you are giving some calcium channel blockers, that time be aware, please be aware about the pedal edema, and please be aware about the gingiva abscess will be there, gums will be edematous with these things. Okay, so that's why you have to be aware. So notify the doctor if the patient is having pedal edema, and if there is a gingiva abscess. Okay, give the comfortable positions to the patient, elevate the foot of the bed. Okay, next, diuretics you have to give. Next one is diuretics. See, diuretics, actually the body acts as a ADH, it is there, vasopressin will call, antidiuretic hormone is there, that will makes antidiuresis, means what? There is no much, so that will retains the some fluid. Now in hypertension, if there is a more fluid retention, that time what happens? BP will increase, more retention of electrolytes, more retention of the calorie items, whatever there is there. So elemental ions if it is there, electrolytes, okay, electrolytes and fluid if it is more, that time there is absolutely there is an increase in the BP. So that what you have to do? So you have to give the diuretics to increase the urine output. Okay, to increase the urine output, to have the normal fluid status in the body. Okay, so that is where it will decreases the vascular volume to gain the normal fluid status. Understood? Okay, so if there is an increased fluid status, or if there is increased plasma volume, that time also there is an increase in BP. So that what you have to do? You have to decrease the plasma volume or the electrolyte volume, thereby there is a decrease in the BP. Okay, thiazides, loop diuretics, osmotic diuretics, and case sparing. Okay, sparing means it has to be retained. Okay, so actually in the normal, what it happens, the potassium is pumped out through the urination. Now you are giving some potassium sparing, means spironolactone. So if you are giving that spironolactone, what happens? Actually it will makes the diuresis, but it will retains the potassium, not the more than normal. It already less, there is a decreased potassium in the body due to the more sodium and the fluid status. Okay, and due to the aldosterone actually. Okay, so that K plus pairing will makes the diuretics, this type of diuretics will makes the potassium to be retained in the body, right? Okay, nursing management, intake and output chart you have to do. So for per day, it's a per day how much, the per 6 hours according to the doctors, per day or per 6 hours or per 12 hours, how much they have asked, that much they have to give the readings. Okay, intake and output chart. BP, okay, you have to check the BP, serum electrolyte level, especially the calcium, potassium and the sodium. Okay, so administer the diuretics only on morning. This is very important. What it is? On morning you have to give at the morning, thereby there is a increase in output, urinary output. What happens if you give it at the night? Can anyone tell me in the chat box? If you give at the night time, he will go for the increased in urine output, so he will never sleep correctly and his sleeping pattern disturbs. Okay, sleeping pattern disturbs, right? So for that purpose you have to administer the diuretics on morning. Okay, next. So first line drugs and second line drugs are there. First line drugs is remember AC and CCB, you remember. Okay, AC, CCB, ARB and thiazides of the diuretics. Finished. First line means you have to give first priority, first drug for the hypertension is these drugs you have to give. Okay, next second line drug means you have to give the second priority after these things. After first line you have to give the second priority, the second line. Beta adrenergic blockers, diuretics, loop diuretics mainly. In the diuretics there are different diuretics, right? So thiazides, loop diuretics you have to give. Did I said that one? Yes, thiazides, loop diuretics, osmotic diuretics, case plus. So thiazides you have to give as a first and this one loop diuretics as a second line. Okay, next alpha, this one alpha receptor blockers and alpha 2 receptor blockers. Receptor blockers you have to give. Okay, not alpha agonist. No, agonist will make the vasoconstriction. This will make the vasodilation and you have to give the vasodilators too. Okay, so this much is enough for this one drugs. We will go to the next. For according to the age, less than 55 years of age, like adults or the people who are having puberty age. Okay, for them. So that is AC inhibitors is the first line, CCB inhibitors is first line in more than 55 years of age. Okay, so in the second line it's very easy. In the second line you have to give both. Second this one second time. So first time you have given this one, second time you have to give this one. Okay, you understood this one? Okay, we will go to the next. Nursing diagnosis. Here, because of the diuretics if he taken at the night or if he is having diuretics at morning, so he want to sleep at the morning, there is a presence of sleeplessness. On the sleeplessness also you do because of the high BP also you can do the sleeplessness, and because of the patient is irritated and fatigue or weakness. Okay, based on the knowledge, hypertension, what the diet they have to do. Okay, whatever the hypertension means. Okay, is there hypertension crisis or normal hypertension, is that primary or is that secondary? What type of hypertension? They don't know hypertension when it comes. What are the causes of hypertension and what are the signs and symptoms that may caused by the hypertension, that will be said in the knowledge. Okay, so and you have to write about the nutrition. Okay, you have to limit the sodium intake. Okay, and you need to increase the water. Okay, in water intake. Okay, you need to increase the water intake so that it may flush out the sodium. Okay, next another one is nutritional status, exercises. Based on the exercise also you can say. Okay, this is all about the hypertension. In the next class we will discuss about the angina pectoris, because today I have to do about all the disease condition. I thought like that, but actually what happened here in our devices, it is not that much of storage. Due to this I pray to the Allah to give it again in my whenever I have that much of capability, I will take, inshallah. But now it's okay for you people, hypertension. So I will do it again whenever when I got the time. Okay, so if it is about only or 3 or 5 days, I will do it. Okay, don't worry for the other angina pectoris or heart attack, heart failure, whatever it is, I will do it. Okay, so until then, take care and be connected with the KN Education YouTube channel. Whatever the issues you have, actually I have to do the heart attack today, right? So I will do it, don't worry. Okay, we will do it. Thank you for watching this video, and hopefully your people are doing well. Thank you.